So coming to what is watering eye, it is excessive secretion of tears or inadequate drainage. So excessive secretion is called as hyperlacrimation and inadequate drainage is known as epiphora. So it is the inadequate drainage of normally secreted tears. Now coming to the etiology, so etiology for hyperlacrimation differs from that of the epiphora. So this hyperlacrimation can be either primary, reflex or central. In the primary hyperlacrimation, it is due to direct stimulation of the lacrimal gland. So this can occur in case of early stages of lacrimal gland tumors and with the use of parasympathetic drugs. The reflex hyperlacrimation is due to stimulation of the fifth cranial nerve. So this is the sensory nerve for the cornea. As so that's why when there are lesions in the lid, conjunctiva, cornea, like stye, hordeolum internum, trichiasis, in case of conjunctivitis, corneal abrasions, ulcers, and acute glaucoma. So it causes fifth nerve stimulation leading to reflex hyperlacrimation, and central hyperlacrimation is due to emotional status and the center for it is not known. Epiphora can be either physiological or pathological, and the pathological occurs due to the mechanical obstruction of the lacrimal apparatus. So the physiological epiphora is due to lacrimal pump failure. So this is the pump which occurs in the uh, lacrimal apparatus, which drives the fluid in the conjunctiva into the lacrimal sac, which drains through the nasolacrimal duct into the passages. Okay, the mechanical obstruction can occur anywhere, right from the canaliculi, puncta, and the sac and the nasolacrimal duct. Coming to they can be punctal obstruction or stenosis, and in case of canaliculus, in the upper canaliculus, lower canaliculus, or the common canaliculus, they can be fibrosis or obstruction due to some debris or some other diseases, and they can be strictures in the lacrimal sac, and in case of infections like tuberculosis, syphilis, tumors, like that. And in nasolacrimal duct they can be non-canalization or partial canalization, they can be valves and they can be membranes which cause the mechanical obstruction. Coming to the investigations of the watering eye, we have roplas test, that is regurgitation on pressure over the lacrimal sac area. Then we have FDDT, that is fluoresin dye disappearance, in which we put 2 drops of fluoresin and after 2 minutes we check the conjunctival sac. If there is no dye, that is normal. If the dye is present, it indicates inadequate drainage. Coming to syringing, it is one of the most important procedures which have to be performed before taking any intraocular surgery. So it involves anesthetizing the conjunctiva with 4% xylocaine. Then we use a lacrimal cannula and the normal saline is pushed into the lower punctum. In normal cases, it goes into the nasolacrimal duct to the sac and all, and the patient swallows it and there is no regurgitation, that is coming back from the punctum. Okay, in case there is a obstruction in either the same canaliculus or in the common canaliculus, there will be the clear fluid can be regurgitated through the same punctum, that is CFR through same punctum. And if the obstruction is either in the lacrimal sac or the nasolacrimal duct, then the clear fluid will regurgitate from the opposite punctum. Understood? So this is the basic procedure for syringing and this. Coming to Jones dye test. So in this test, it is useful to differentiate a case of partial obstruction and where the obstruction lies. So in the test 1, it is performed by with the help of 2% fluorescent dye, which is put at the conjunctival sac. After that, a cotton bud is dipped in the xylocaine and it is put in the inferior meatus. And we will check the status of the cotton bud after 5 minutes. So after 5 minutes, if the dye is present, that is the cotton bud is stained, that indicates the passages are patent and it is due to primary hypersecretion. If the dye does not come, then it indicates either partial obstruction or pump failure. So in test 2, we perform lacrymal syringing with normal saline and then check the cotton bud. So when we check if the dye is present on syringing, that indicates there was some partial obstruction. So applying pressure lead to the coming of dye. But when the dye does not come, it is pump failure. That means the dye has not entered the sac itself. Understood that that is Jones dye test. Thank you. Stay tuned for the next class. We will discuss case scenarios of these tests. Thank you.